My name is Kimberly King. I'm starting on my neuro assessment. And to start off, we're going to start with the cranial nerves. Cranial nerve 1, we're starting off with this for smell. I'm going to have my patient smell 2 different specimens, holding one side of the nose each time to tell me what the smell is. All right, hold one side of your nose.
Cinnamon.
Correct.
Cinnamon.
Correct. All right, and the second one. Good.
Chocolate-ish. Cocoa.
Correct.
Chocolate.
Correct. All right, next I'm going to go on to cranial nerve 2. This is for vision. I'm going to stand back behind the patient and check for visual fields. All right, you let me know when you see my fingers.
Now.
Okay.
Now.
Okay.
Now.
Okay.
Now. Now.
Okay, good. All right, next we are going to check the pupils to make sure they are round and reactive. Look at me. Good. They are both round and reactive to light, and they adjust equally. Next, I'm gonna make an H and have his eyes follow my fingers without movement of his head. Good. Convergence is noted as I go towards the nose. Next, I'm going to check cranial nerve 3, 4, and 6. I'm going to make the same H. Have him follow my fingers. Convergence is noted while placing our fingers to the nose. Next, I'm going to move on to the cover and uncover test. Check for any extra eye movements. Okay. None noted. Good. Okay. Next, I'm going to check for visual acuity. I'm going to have the patient cover one eye without closing it. I'll have you read the first, second, and third line for me.
5'6", 4'7", 3'7", 4'8".
Correct. All right, now switch to the other eye. Do not close it. Now read.
5'6", 4'7", 3'7", 4'8".
Correct. Okay. Next, I'm going to move on to cranial nerve number 5, and that is for trimingle. I'm going to inspect the jaw. The symmetry is noted from the jaw. Next, I'm going to palpate the jaw muscles. Non-tender. Okay. Next, I'm going to have him act like he's chewing. Chew. Good. Now stop. All right. No problems with that. Next, I'm going to move on to cranial nerve 7, which is facial. I'm going to have you lift your eyelids. Good job. All right. Now close your eyes tight shut. Okay. Good. All right. Next, I'm going to have you wrinkle your forehead. Good job. All right. Next, I want you to frown. All right. Now smile. Show your teeth. Good job. All right. I want you to purse your lips. Good job. Blow your cheeks out. Good. Next, say B.
B.
M.
M.
P.
P.
Good job. No defects are noted. Checking for symmetry of the face. Full symmetry is noted. Noted the labial-nasal folds. Symmetry is noted there. Next, I'm going to move on to cranial nerve 8, and that is for hearing. I'm going to start with the whisper test.
Yes. Yes. Yes.
Okay. All right. No defects noted there. Next, I'm going to move on to the Renee test, and that is where I'm going to tap the tuning fork and I'm going to place it to the mastoid process. When the patient can no longer hear it, I'm going to move it in front of the ear, and he should still be able to hear it. So.
Let's go with yes.
Okay.
Let's go with yes.
Good. Okay. Next, I'm going to move on to the Weber test. And the Weber test is where we're going to see if the patient hears the noise in the right ear, the left ear, or in the middle.
Middle.
Correct. All right. Next, we are going to move on to cranial nerve 9. It is to check the gag reflex and swallowing. So I'm going to use a tongue depressor. Gag reflex is noted. And you just swallow for me. Good. No problems with that. Good. All right. Next, I'm moving to cranial nerve 10. It's for to check the vagus. I'm going to be checking for the uvula and the soft palate. Uvula is noted. Soft palate's noted. Swallow. Correct. Okay. No defects noted there. Next, I'm going to move on to cranial nerve 11. That is for trapezius. I'm going to have the patient shrug your shoulders. Good job. All right, next I'm going to have you turn your head side to side. All right, no problems noted with that. Next, I'm going to move on to cranial nerve 12. That's for the hypoglyceal reflex. I'm going to have you do some tongue exercises. Stick your tongue out. Side to the other side. Good job. Okay, next I'm going to have you push your tongue against both sides of your cheek wall, one at a time. Good job. Other side. Good job. All right, next I'm going to have you swallow. Good. Now say L,
L,
T,
T,
D,
D,
N.
N.
Good. No defects are noted there. Next, I'm going to move on to the fine motor skills. I'm going to have you pat your knees with your hands. Good job. Now stop. I'm going to have you turn your hands up and then upside down, back and forth. All right, stop. Okay. No problems noted there. Next, I'm going to have you touch your finger to your nose. Good. Other hand. All right. Next, I'm going to have you touch each finger to your thumb on both hands. Good job. No defects noted there. Next, I'm going to move on and do the broad nerve test. Stand up. Okay. Stand still. All right. No swaying noted. All right. Close your eyes. Slight swaying noted, but that's normal. Next, you can stand on one foot, open your eyes. Good. All right, stand on the other foot. Good. All right, now hop on one foot. Good. You can stop. All right, next I'm going to move on to the cortical sensory. Sit down. This is going to check for stereognosis. I'm going to place three objects while his eyes are closed. In one hand, he can feel it, but he has to tell me what it is. Close your eyes.
Bobby pin.
Correct.
Battery. A ring.
Correct. Other hand.
A ring. Bobby pin. Battery.
Correct. No deficits noted there. Next, I'm going to move on to the sensory function, and I'm going to check for painful and soft stimuli. I'm going to start with the face. Tell me if it's hard or soft.
Hard. Soft.
Okay. Next, I'm going to move on to the chest.
Soft. Hard.
Okay. Arms.
Hard. Soft. Soft. Hard.
Okay. All right. Next, onto the head.
Hard. Soft.
Okay. feet.
hard, soft,
Correct. Okay, no deficits noted there. Next I'm gonna move on to the reflexes. I will be checking first, is the biceps reflex. Okay, reflex noted. All right, next is the brachioradial reflex. Okay. Okay, reflex noted. Next, I'm gonna be checking the tricep reflex.